Welcome to Angel Health Academy. Topic for the day or topic for the session is healthcare team in hospital. Healthcare team in hospital. In India, our hospital has got a various healthcare team. Okay, the team of healthcare is composed or it consists of diverse group, that's different type of the professionals, semi-professionals, non-professionals, etc. Okay, who work collaboratively, okay, as a teamwork together to provide comprehensive medical care or health care to the patients in the hospital. So in the Indian context, in the hospital we have a healthcare team. The team members varies from a hospital to hospital or according the type and according the size of the hospital. Okay, they function collaboratively together with a common goal or common objectives, and thus they render the comprehensive medical care or quality medical care to the patient. Okay, as I have already mentioned, the composition of the team members, okay, the members of the team varies depending upon the types and different type and size of the hospital. Okay, like public or government sectors, private sectors, private hospital, multi-specialty hospital, super specialty hospital, referral hospitals, research hospital, etc. Okay, I have been already uploaded a video of classification of hospitals. Okay, if you have not watched that, please go through that and understand what are the different types or classification of hospital. Okay, the healthcare team in the hospital is directly depends upon the type of the hospital. Okay, the number of the health team members is depends upon the size of the hospital. Okay, these both things I have explained in my last video about the classification of hospital or hospital administration. Now let us see about the members of healthcare team in the hospital. Members of healthcare team. So this is the common or general, okay, healthcare team in the common hospital or general. Okay, it may vary according to the type and size of the hospital. First one is doctors or physicians. Second one is nurses. Third one is pharmacists. Fourth one is medical technicians and technologists. Fifth one is allied health professionals. For to help the health professionals, we have various allied other health professionals. Then administrative and supportive staff, that is administrative and support staff for the administration, office management, etc. Then we have social workers and counselors, okay, to give counseling advice, social workers and counselors. Ninth one is emergency medical team or emergency medical services team, that is EMS. So when an emergency occur in the hospital system, for example heart failure or heart attack, okay, this emergency team will take care of the particular situation or they manage the particular situation. That team is called emergency medical service team, EMS. Then housekeeping and sanitation staff to maintain the cleanliness in the hospital, housekeeping and sanitation staff. Then 10th one is intensive care unit or ICU team, okay, a team of the professionals who take care of the intensive care patient or coronary care patients, okay, or patients those who are admitted in the ICU, intensive care unit. Okay, then 11th one is palliative and hospice care teams to render the services to the chronically ill patients, okay, and patients who required prolonged care either in the hospital or in the home based. Okay, that is palliative and hospice care teams. I have already done a video regarding the healthcare agencies in India, both private and government. In that I have explained in detail about the palliative care and hospice care. Okay, you can go through that if you have not watched it still. Then you can understand better what are the different healthcare agencies in India to render the various specific services. And 12th one is public health and outreach teams. Actually, hospital render various public health programs or public health sessions such as health education, conducting health camp. Okay, that could be done by this team, that is public health team or outreach team, to render the outreach services in the community. Okay, so these are the 12 different common or general members of the healthcare team in the hospital. Let us discuss in brief or in short about different members of the healthcare team in the hospital. First is doctors or physicians. Doctors or physician includes general physician, specialist, consultants and resident doctors. First is general physician. So most of the medical conditions are first seen by the physician or general physician, and according to diagnosis they refer the case into the specialist. Okay, so general physicians are the doctors who provide comprehensive medical care or provide primary care. Then they diagnose the cases, and based on the diagnosis they treat the cases with the various medical conditions. So that is about the general physicians in the hospital. Second types under physician is specialist. Okay, doctors who specialized after MBBS in a specific area of medicine is called specialist. We have various types of specialist. For example, cardiologist to take care of the heart related problem or heart care. Then neurologist, that is related to brain and nervous system and spinal cord. Okay, the problem related to brain and nervous system, spinal cord, all dealt with or managed or given treatment by the neurologist. Okay, that is a special consultation. Then oncologist, they give the treatment for the cancer. Okay, diagnosis and treatment for the cancer, oncologist. Orthopedician or orthopedist, related to the bone and joint care, fracture, etc. Okay, orthopedician or orthopedist. Then pediatricians, they give the care to the children, that is child care is given by pediatricians, they are specialized in pediatrics. Then obstetrician and gynecologist, OB and gynecology, obstetrician and gynecologist. Obstetrician and gynecologist manage the gynecological problem of the women, and obstetrician manage the care of the woman during antenatal period, during pregnancy, during childbirth, and after the pregnancy, that we call postnatal care, and in the care of the child during the birth, also including obstetrician and gynecologist. Okay, so that is they care the women's in reproductive health and the childbirth related problems, and the process of delivery and childbirth also done or conducted by the obstetrician and gynecologist. The next is surgeons. Surgeons are those who are specialized in performing the surgeries. Okay, in that also there are various categories. Okay, such as general surgeon, cardiac surgeon, orthopedic surgeon, etc. So according to their specialty, they do the different type of or that specific surgery. Okay, so these are the some of the type of the specialist. At present we have a specialist in all the area of the medicine. Okay, then third one is consultants. Usually the senior doctors of the hospital, okay, senior doctors or senior specialists who provide the expert opinion when there is a problem, when there is issues, when there is a case they have to deal in a collaboration as a teamwork. Okay, in such a situation the expert guidance is given by the senior doctors or specialists. They are called consultant. Okay, then of course they lead the patient care in that particular hospital because of their experience and expertise. Okay, so senior doctors or specialists who provide expert opinion, advice, instruction, guidance, and lead to patient care in their areas of expertise are called consultants. And of course they conduct the consultation in their own specific or special areas. So that is about the consultants. Then fourth one is resident doctors. Usually they are the junior doctors, MBBS doctors. They are in the training period, internship period. So junior doctors in training who assist the patient care of the senior doctors or physician. Usually resident doctors will assist the physician or the doctors in the patient care. Junior doctors in training who assist the patient care in the hospital under the supervision of the senior doctors. So these resident doctors, they are the junior doctors or MBBS doctors during the internship period or training period. Usually they act as an assistants for the senior doctors. Okay, and under the supervision of the senior doctor, they render the comprehensive medical care to the patients. The second category or health team member in the hospital is nurses. Okay, most significant and important health team member is nurses. Nurses includes registered nurses, RNs, okay, registered nurses, registered midwives, then nurse practitioners, okay, NPs, then nursing assistants and specialized nurses. So they are specialized with some special areas. Okay, so registered nurses, nurse practitioners, nursing assistants and specialized nurses. First one is registered nurses, RN. So after the BSc nursing program, the nurses has to get the registration, that is the license that is given by the particular state where she completed the particular BSc programs. Then after the registration, they call registered nurses with the registration number. Okay, so registered nurses provide the direct patient care. Okay, direct patient nursing care or comprehensive nursing care or quality nursing care. That includes direct patient care, administration of medications, monitoring the patient health status, assessment, continuous assessment. Okay, and assisting the surgeries and operations, and coordinate with all the healthcare team members. Okay, and follow the instruction of the physicians during the treatment of the particular patient. Okay, so they coordinate the care with the doctors and other healthcare professionals and paramedical professionals. Okay, then second is the nurse practitioners. Actually, after MSc nursing, a nurse can become a practitioner. Okay, so nurse practitioners or advanced practice nurses who can diagnose the patient and who can treat the medical condition and who can order or prescribe the medication for the patient, and she can completely manage the patient care either independently or with the collaboration of the doctor. Okay, so along with the doctor or independently alone, she can do the diagnosis, treatment and complete management of the patient. That is comes under nurse practitioner. Actually, in India, it is not practicing at present, but in abroad and foreign, there are advanced practice nurses or nurse practitioners or nurse clinicians, nurse consultants. So they do independently patient care management, like diagnosis and treating the particular condition under their supervision. Okay, so that is called the nurse practitioners. The basic qualification of the nurse practitioner is MSc nursing. Okay, with one speciality. She has to complete the MSc nursing and she has to get the registration after MSc nursing to practice in that particular state. Okay, that is about the nurse practitioners. The next one is nursing assistants. They are also called support nurses or assistant nurses or nursing aides. Usually they help the nurses to render the basic patient care. Okay, the basic patient care tasks such as bathing the patient, sponge bath, feeding, raised tube feeding, okay, or other oral feeding, and monitoring the vital signs, checking the vital signs of the patient, etc. So these nurses are support the registered nurses or help the registered nurses. Thus they are called nursing assistants. Usually it is done by the auxiliary nurse, midwives. They act as a nursing assistants in the hospital. They assist the registered nurses in rendering the basic patient care. Okay, then fourth one is specialized nurses. Specialized nurses who focus on specific field, one specific specialty in nursing, such as critical care area, neonatal care, okay, newborn care, or in oncology area, or in surgical nursing, or in OT, etc. So nurses can specialize for 1 year program, 1 year course after the BSc nursing or after the GNM nursing. They can go for 1 year program in any specialty. Okay, for example, critical care nursing, neonatal care nursing, oncology nursing, etc., etc. Okay, that is about the specialized nurses. So these are the 4 categories under nurses in the hospital as a healthcare team member. The third important member is pharmacist. Of course, there is a pharmacy in the hospital who distribute the medicines to the patients. So pharmacist includes a hospital pharmacist and a clinical pharmacist. So there are 2 types of pharmacist, hospital and clinical. First one is hospital pharmacist. Usually hospital pharmacist work in the dispensary or pharmacy in the hospital. His main responsibility is dispensing the medication as per the doctor prescriptions, okay, and educating the patient about the safe use of the medicine, how to take, when to take, etc., how long it has to take as per the doctor prescriptions. At the same time, the hospital pharmacist has to make sure that is hospital has a proper stock for the pharmaceuticals. Okay, the needed medicines or required medicines for the patient should be available all the 365 days in the year. Okay, in the hospital. That is ensuring the hospital has a proper stock of pharmaceuticals or what is required medication for the patient, those who are admitted in the particular hospital. Okay. The next type is the clinical pharmacist. So clinical pharmacist work closely with the doctors and nurses in the clinical area or in the ward to optimize the medication therapy. Okay, make quality medication therapy, and also ensuring that the patients are receiving the correct dosage and correct combination of the drug, etc., is the important role of the clinical pharmacist. So usually clinical pharmacists work in the clinical area. They work closely with doctors and nurses, and they make sure that all the patients are getting the correct dosage of the medicines and correct combination of the medicines. So this is about the pharmacists. Next is about the fourth one is medical technicians and technologists in the healthcare team, okay, in the hospital. Medical technicians and technologists. So it includes laboratory technician, lab technicians, radiology technicians, radiographer, surgical technicians and dialysis technicians. So laboratory technician, radiology technicians, surgical technicians and dialysis technicians. First one is laboratory technicians. Laboratory technicians perform the various diagnostic tests in the hospital, such as blood examinations, urine examinations, other body fluids, tissue analysis, etc., all in the hospital lab. Okay, so she performed diagnostic test as per the prescription of the doctor. For example, blood test, urine test, stool test, tissue analysis, etc. Okay, next is radiology technician. Usually the radiology technician operate the imaging equipment available in the hospital as a part of the diagnosis. For example, X-ray technician, CT scanner and MRI machines, that is magnetic resonance imaging machine. Okay, that this all helps to diagnose the various medical condition of the different patients. So radiologist or radiology technician operate the imaging equipment in the hospital. Then surgical technicians or OT technicians, something related to operation theater. Okay, so surgical technician or OT technician assist the surgeons during the operations, various operations, by preparing the surgical instruments necessary for that particular surgery and maintaining the sterile environment in the operation theater to protect the patient. Okay, maintaining sterile environment. So these are the role of the surgical technician or OT technician in the hospital healthcare team under technicians. Then fourth one is dialysis technicians. That is nothing but dialysis technician provide the care to the patients who are undergoing the dialysis. Okay, dialysis treatment for kidney failure, okay, chronic kidney diseases, CKDs. Okay, so dialysis technician provide the comprehensive care to the patient who are undergoing dialysis for the treatment of kidney failure. So these are the various technicians present in the hospital healthcare team members. Next, allied health professionals, other health professionals who support the medical care of the patients. It includes physiotherapist, occupational therapist, speech therapist, dietitian or nutritionist and respiratory therapist. So these are the some of the allied health professionals who comes under the healthcare team members in the hospital. First is physiotherapist. Of course, physiotherapist help the patients in the hospital to recover the mobility, movement and strength of the muscular system. Okay, through physical therapy or physiotherapy. Okay, especially after the surgery or after an injury, any fall, accidents, etc. Okay, so physiotherapist help the patient to recover the mobility, movement of the various joints and strengthening the muscles and joints. Then second is occupational therapist. Occupational therapist assist the patients in regaining the psychomotor skills that is needed for the daily living or working, particularly those with physical disabilities or injuries. Okay, so patient with physical disabilities has to be improved or regained skills for the activities of daily living or going back to the work. Okay, for that a specialist is called occupational therapist who help the patients with the physical disabilities to regain the psychomotor skills and regain the working skill of the particular patients. Then speech therapist. Speech therapist help the patients who have difficulty in speaking after an incident of a medical condition such as stroke, etc. Okay, speech therapist help patients who have difficulty in speaking or swallowing, often after a stroke, okay, paralysis or traumatic injury, any injury or trauma. Okay, then dietitians or nutritionist. Usually dietitian or nutritionist provide dietary advice, okay, and plan the therapeutic diet. That means they develop nutritional plans for the patient based on their medical condition. For example, diabetes patient, diabetic diet, okay, hypertension patient, dash diet, and heart disease patient, a particular diet. Okay, so dietitian provide dietary advice, guidance, instructions, and she plan or develop the diet plan or nutrition plan for the patients according to their medical or different medical conditions. Then respiratory therapist, as the term indicate, they are dealing with the respiratory problems. So respiratory therapist is specialized in caring the patients or caring for the patients with breathing difficulty, okay, and those who are in problem of the respiratory system, any issues with the respiratory system or breathing difficulty, etc. They usually work or often they are present in the critical care unit, emergency care unit, or with the patient with the ventilators. Patient is breathing with the help of the ventilators, okay, in intensive care unit or coronary care unit, critical care unit, etc. That is about the respiratory therapist. So these are the some of the important allied health professionals who support the medical care in the hospital team. Next is administrative and supportive staff. So of course hospital is an organization. We have to manage other official work and other things. For that there is administrative and supportive staff, which includes hospital administrators, medical record officers, ward boys and hospital attendants, then billing and reception staff. Of course hospital must have a reception and billing system, payment system, etc. For that billing and reception staff. First one is hospital administrators. Hospital administrators oversee the day-to-day activities or operation of the hospital, function of the hospital, which include staffing, managing the staffing of the hospital, budgeting the hospital for the particular year, okay, then patient care services or quality or standard patient care services, and even outreach services, etc. overseen by the hospital administrator for the smooth running of the hospital functions and maintaining the quality and the reputation of the hospital. Then medical record officers, they manage the patient health records, patient case sheets, etc. Okay, they also ensure the accuracy and updated recording of the patient document system. Thus medical record officers ensuring that is that all the records are accurate and updated in compliance with the healthcare regulation, healthcare act or healthcare policy or hospital policy. Based on the hospital policy, all the record of the patient must be accurate. Accurate means clear or correct, okay, updated, okay, the relevant informations, okay, current informations, etc. Okay, so this is the responsibility of the medical record officer in the hospital healthcare team members. Then ward boys and hospital attendants. So there are ward boys and hospital attendants in the hospital as they provide the non-medical services and non-medical support for the patients, such as transporting the patients from one department to another department, from reception to the ward, okay, and during the discharge process, etc. Then of course they involve the cleaning of the patients and assisting with the patient comfort, okay, all the comfort services are rendered by the ward boys and hospital attendants. The last one is billing and reception staff. Billing and reception staff handle the patient registration, patient billing, okay, payment system, insurance claim of the patient, and front desk inquiries. That is nothing but giving clarification, information, instruction about the hospital and its working conditions, functions, etc. to the public or to the patient and patient parties. So billing and reception staff handle the patient registration, hospital registration, admission registration, then collecting the admission fees, and billing the discharge of the patients, then supporting the patient to get the or claim the various insurance, government and private insurance, and giving information, clarification for the patient as front desk inquiries. The seventh type of healthcare team members in the hospital is social workers and counselors. Social workers and counselors. It includes medical social workers and psychologist and psychiatrist. Medical social worker and psychologist and psychiatrist. First one is medical social worker. Medical social worker help the patients and their families to navigate the healthcare system, to go through with the healthcare system without any difficulty and without any problems, both physically and financially. Okay, thus they providing emotional support to the patient and the patient parties or bystanders or family. Then providing advice in the finance, introducing various health schemes, health insurance schemes, okay, concession system for the family to support the financial crisis of the patients and the family, and providing assistance with the arranging the follow-up services, follow-up care, referral services, etc. Okay, thus medical social worker help the patients and their families to navigate the healthcare system by providing emotional support, financial counseling, and assistance with the arranging the follow-up services for the patient in the next time in the hospital and other hospital systems. Next is psychologist and psychiatrist. Psychiatrist actually is a specialist only, but they also comes under counseling services. So they provide mental health support to the mentally ill patient, including counseling, psychotherapy, medical management for patient with various psychological issues and hospital related or admission related stress and strain of the patients and patient families. Eighth one is housekeeping and sanitation staff. Housekeeping and sanitation staff to maintain the cleanliness in the hospital, okay, thus to prevent the infection in the hospital related infections, etc. These essential workers, so they are very essential worker and basic workers. They ensure the cleanliness and hygiene of the hospital environment, complete hospital premises, okay. They play a crucial role in the infection control in the hospital, thus maintaining a safe environment for patients and its staff, patients and bystanders, patients and public, etc. So this is about housekeeping and sanitation staff under healthcare team members in the hospital. Ninth one is emergency medical service team, EMS. It includes paramedics and EMTs, okay. Both these paramedics and EMTs, they provide pre-hospital emergency care for the patient and family, okay. Then they admit the patient to in the emergency department for the critical care. Then of course they escort the patients during the critical condition. The patients are transferred from this hospital to other hospital where more facilities are available or more medical care is available or more emergency care is available. That is about paramedics and EMTs. Second is emergency room staff, ER staff, okay, emergency room staff. So this team include emergency physicians, trauma surgeons and nurses, specialist nurses who specialized in treating the acute injuries of the patient, acute medical condition like myocardial infarctions, etc. in an emergency department, okay. This team will take care of the patients in emergency condition in emergency department, okay. They include emergency physicians, emergency trauma surgeons and nurses, etc. So this is about emergency room staff in the hospital as a health team members. Then 10th is intensive care unit team. Intensive care unit team. It includes intensivists, critical care nurses and respiratory therapist. We are already explained about the respiratory therapist. So she also is a part of the intensive care unit or ICU team, okay. First one is intensivists. Intensivists nothing but they are the doctors. They are specialized in critical care medicine for the patient in critical care, those who are admitted in the ICU, intensive care unit. So doctors specializing in critical care medicines who oversee or supervise or take care of the patients in the intensive care unit with critical medical care. Then critical care nurse, the nurse who have specialized in critical care nursing, okay, provide the round the clock 24 hours care to the patients with the life threatening conditions, okay. Whenever patient become life threatening condition, this particular or specialized nurse will provide the 24-hour services. That is about the critical care nurses in the hospital team under intensive care unit team. Then respiratory therapist, we already discussed about the respiratory therapist. She assists the patients on ventilator and monitor the respiratory functions, normal lung functions in all the critically ill patients, ICU patients or intensive care unit patients, okay. So respiratory therapist assists the patients on ventilators, okay. Ventilator give the artificial respiration for the patient who cannot breathe normally, okay. And she also monitor the respiratory functions or lung function of the patients, those who are in a critically ill in the critical unit. The 11th one is palliative and hospice care teams. Palliative care teams and hospice care teams. First one is palliative care specialists. They manage the symptoms and improve the quality of the life of the people or patients with serious illness. So palliative care team deal with both in hospital and outside at home for the serious illness people, okay. And they provide home management, okay, symptomatic management and emotional support, counseling, etc. for the patient to improve the quality of the life during the serious illness. Then second is about the hospice care providers. Hospice care providers or these healthcare team members offer the end of life care to the patient with the terminally ill. Okay, they offer end of life care to the terminally ill patients and focusing on the comfort of the patient rather than the curative treatment or management. They are not focusing on the medical management of the client, but they are making the physical comfort and mental comfort of the patient. So they make the patient comfortable as they are at their home. Okay, that is called hospice care providers. So these will comes under palliative and hospice care teams in the hospital. Now the 12th one is public health and outreach team members. Public health and outreach teams in the hospital. In some hospital or a few hospital there would be a team. Okay, the team is responsible for the public health initiatives or public health programs or activities. And moreover they conduct the various community outreach programs like immunization program, conducting health camp, health education sessions, other disease prevention efforts in the community or in the nearby wards. Okay, so a few hospital have the team like a public health team or outreach team services to render the various community related programs and initiatives. Okay, for the public health awareness and maintaining the good public relationship with the hospital. This is all the part of the preventive measures or preventive efforts from the part of the hospital to improve the public relation or relationship with the public and the hospital. Okay, so today we have discussed about the various members of healthcare team in the hospital. Okay, it includes doctors or physicians, nurses, pharmacists, medical technicians and technologists, allied health professionals, administrative and support staff, social worker and counselors, emergency medical service team, housekeeping and sanitation staff, intensive care unit team, palliative and hospice care teams, and public health and outreach team in the hospital. So these are the general health members or healthcare team members in the hospital. So thanks for watching. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next academic video. The important thing is don't forget to subscribe my channel and convey your gratitude in the comment box. Okay, once again thank you so much for watching my video.